All right, welcome to my presentation on cardiac shunts. So today's presentation will cover these four cardiac shunts: ASD, VSD, PDA, and PFO. The first one we're going to cover is going to be ASD, which stands for atrial septal defect. Atrial septal defect gives meaning to the location of where the defect is going to be, which is the interatrial septum, but we'll be referring to it as IAS for short. And this happens when there is a failure to close properly during the fetal development, leaving a defect or a hole that allows the blood to shunt between the left atrium and the right atrium. Now, this is similar to PFO, but it is actually different, and we will go over the difference when we reach PFO later. So, for ASD, there's five types. There is the ostium premium, ostium secundum, sinus venosus, coronary sinus, and coronary atrium. Of the five types, the ostium premium and ostium secundum are the two most common types of ASD, with ostium premium making up about 20% of the total cases and ostium secundum being the most common, making up about 70%. In third place is the sinus venosus, which makes up the remaining 10%. And the other two, which are quite rare, they are not really counted into the percentage, but they are the coronary sinus and the common atrium. So, as mentioned earlier, the location of ASD are usually somewhere along the IAS, but to go into more information and definition, the ostium premium is located in the inferior portion of the IAS. The ostium secundum is located in the um, mid portion of the IS. The sinus venosus is located superior to the superior portion of the IS, near the junction of the SVC and RA. And the coronary sinus, as its name would suggest, is located near the coronary sinus. And the common atrium is actually when there is an absent or near absence of the IS, resulting in more one common atrial chamber only. So for echo-related findings, sonographers, we are going to try to utilize all the views that will give us the IS, and with the most efficient and best views being the SACS view and the subcostal view. And they should provide the best visualization of ASD with the correct Doppler angle. And these are on the slide is just a photo showing how ASD will look like. As you can see, there is a hole right here between the RA and the LA right here. Okay. All right. Sorry about that. Okay. So this is going to be our VSD. And VSD is similar to ASD as is the ventricular septal defect. Um, and just like its name is kind of telling us where the location is going to be and the chambers that are going to be involved, which are going to be your two ventricle, and VSD stands for ventricular septal defect. And the definition is that this is where the failure of the IVS to close properly during the fetal development, and this allows for blood to shunt across from the IVS in between the LV and RV. And for VSD types, they can vary in sizes and also correlate to the components of the ventricular septum, meaning that these categories of different types of VSD will be based on their bordering anatomy. So, for example, the most common VSD is the membranous septal or perimembrane septal VSD, which is bordered by your tricuspid valve, aortic valve, and muscle. Another example would be your trabecular or muscular septal VSDs, and those are usually located between the bodies of, let's say, the left and right ventricle, but usually on the lower part of the septal wall and the thicker and more muscular portion of the septal, closer to the apex and completely surrounded by muscle. And this specific type will have more of like a Swiss cheese appearance. So as we can see, the the anatomy around it sort of gives them their specific name. All right. But VSDs are not always just between ventricle. There is types of VSDs that can also be between a ventricle and a atrial, and those are known as your atrioventricular septal VSDs. So for echo finding, we should seek to utilize all views that can visualize the IVS. This will allow us to see which type we have, but the most effective views are probably going to be the long axis and the subcostal four chamber. They often provide the best visualization of your VSDs. And as we can see here on this picture on the VSD here, this is going to be your four chamber. And with color flow Doppler, you're going to be able to see um, the turbulent flow that's going through right here. Okay. And oh, how do I get to the next slide? Sorry, one sec. Okay. So next is our PDA, which stands for your patent ductus arteriosus. PDA it's another congenital heart defect, but it differs from your ASD. Um, at birth, the ductus arteriosus functionally closes within 15 hours after the baby takes his breath, but it will actually structurally be sealed within 2 to 3 weeks. In time, once it's sealed, the DA um, becomes the ligamentum arteriosum. Now, during that development time, if the DA, which is the ductus arteriosum, fails to close, it results in a becoming a patent ductus arteriosus, which is PDA. This leaves an abnormal communication between the aorta and the pulmonary artery, and the flow reversal, it places a burden on the right heart and the lungs, and ultimately back on the left heart because of the volume overload. And for the echo findings, with color flow, there usually is a Adidas symbol um, like resemblance to the turbulence that is shown, but that is because the PDA usually appears as a turbulent jet and it's traveling between the aorta and the pulmonary artery. So with the color flow, we can actually see that the right pulmonary artery and the PDA and left pulmonary artery resembles that Adidas symbol. I don't have it on screen, but that's one of the key characteristics we can take away from it. Excuse me. So because there isn't too many views that will show us the aorta, the pulmonary artery, we should seek to use the parasternal sac space, subcostal sac space, and parasternal long axis and short axis view to try to see this PDA as closely as possible. And as I mentioned before already, color flow Doppler is very useful when it comes to trying to identify the PDA. And we definitely want to make sure we are taking note of the velocity and the direction. Okay, and lastly is our PFO. And the definition is PFO is another type of congenital heart defect. Um, it is when a foramen ovale is It's a small, a foramen ovale is a small opening between the two upper chamber of the heart, the atrial, that is present in fetal heart. It normally closes after birth, but sometimes it remains open, which is usually referred to as the patent foramen ovale, also known as PFO. And it is important to differentiate between PFO and ASD, um, as you can see with the picture here on the side. And it's important because when there are flaps that are overlapping each other, we consider that PFO. And when there is a clear defect in between the IAS, we consider that a ASD. All right, and that. Okay, and with that, this is the end of the presentation. And just to reemphasize that checking for cardiac shunt is important because these conditions have serious health implication. And given the potential complication, it's very important to see that the cardiac shunts through various tests, but for us, mostly through echo and using different views, as much views as we can, especially for specific anatomies, but also because early detection, it's one of the best things we can do, and it's going to allow for appropriate management of whichever cardiac shunt problem we do have. Thank you.